You know that weird pins and needles feeling when your foot falls asleep or your hands feel like they have frozen somewhere? Yeah, your legs and hands turn into a confused porcupine and you just know something weird's going on. But what if that tingling doesn't go away or happens without any reason at all? Welcome back to DocDecoded, where we break down the mysteries of medicine without putting you to sleep, unless it's medically necessary. Today, we're diving into numbness and tingling, or as doctors call it, paresthesia. It sounds fancy, but trust me, your nerves just might be throwing a tantrum. Paresthesia is that odd sensation of pins, needles, burning, or numbness you feel, often in your hands, feet, arms, or legs. It can be temporary, like when you sit cross legged too long, or chronic, which may signal something more serious. Think of your nerves like electrical wires. When they're pinched, blocked, or irritated, the signal gets weird, and your body responds with those bizarre sensations. Interesting fact. The word paresthesia comes from Greek word, para meaning abnormal, and aesthesis meaning sensation. So yes, it literally means weird feeling. Why do we get numbness and tingling? There are tons of reasons. Here are the common ones. Pressure on nerves. Ever wake up with a numb arm? You probably slept on it, compressing the nerves temporarily. Have you ever heard of the word sciatica? It's that kind of sensation followed by long sitting in same position. 2. Poor circulation. When blood flow is restricted, your nerves don't get the oxygen they need. 3. Vitamin deficiencies, especially B12, which is crucial for nerve health. Deficiency causes nerve damage, fatigue, memory issues, and is easily treatable. 4. Nerve injuries or irritation, like carpal tunnel syndrome, where nerves in your wrist get compressed. 5. Diabetes. High blood sugar damages nerves over time, especially in the feet. This is called peripheral neuropathy. 6. Lesions at many different levels of the nervous system. Sensory symptoms and signs indicate some problem in the nervous system pathways. 7. Radiculopathy. Fancy term for a pinched nerve when you're at certain points, as in cervical or neck region and lumbar or lower back, often caused by herniated discs or arthritis. 8. Multiple sclerosis, MS, an autoimmune condition that damages the protective sheath around nerves. Basically, your nerves are drama queens. Give them a little pressure and they freak out with fireworks. Let's talk about 2 types of weird nerve sensations your body can experience: the extra ones and the missing ones. 1. Positive phenomena, the extra feelings: felt burning, lightning-like shooting feelings, tingling, pins and needle, pricking, band-like or tightening, zapping, or like your skin is crawling, twisting, even when nothing's touching you. Some raw feelings which are often painful. That's what doctors call positive phenomena. These happen when your nerves are overreacting or firing off too many ineffective signals, kind of like a group chat that won't stop buzzing. These buzzing nerves don't always show up as something doctors can see or measure during a checkup, but you definitely feel them. 2. Negative phenomena, the missing feelings. Now imagine the opposite. Numbness or a lack of feeling in your skin, like when your foot is asleep and you can't really tell if you're touching the floor. That's a negative phenomenon, meaning the nerves aren't sending enough signals. Have you ever touched something hot but didn't realize it right away? Because your hand felt numb. That's a sign your sensory nerves might be slacking off. So, when should you worry about numbness and tingling? Red flags include: it's persistent and doesn't go away. It affects one side of your body. It's accompanied by weakness, vision changes, or slurred speech or other associated symptoms. If it starts suddenly, like a lightning bolt out of nowhere. These could point to serious conditions like stroke, multiple sclerosis, or nerve damage from diabetes, also known as diabetic neuropathy. If your hand suddenly felt numb and you also had trouble smiling? Would you go to the emergency room or just wait it out? Comment below. Till now, if you've learned something, please do not forget to like and share. Fact is that some stroke patients describe their early warning signs as an odd tingling in the face or a strange heaviness, not pain. So never ignore that. How much time do you think you spend on your phone or computer on daily basis? Could your lifestyle be silently strangling your nerves? Let me know your habits in comment section. So how do doctors figure out what's going on? Doctor will do physical examination to assess strength, reflexes and sensation. Doctor will check your response to the painful stimulus in different parts of the body. He may also check temperature sensation for both hot and cold. Patient is tested with the eyes closed and should respond as soon as the stimulus is perceived, indicating its location, joint position, and sensation of vibration. Failure in two-point discrimination, touch localization, stereognosis, or inability to identify common objects by petition or recognizing their shape, texture, size, it signifies some issues in the pathways of the nerves. Doctors localized your damage by relating the history and clinical examination. Nerve root problems, like sciatica, can cause deep aching pain along the path of the nerve, often due to a slipped disc pressing on nerves in the lower back. So you may have a tingling sensation starting in your buttocks and extending till your lower leg, either unilateral or bilateral. Single nerve damage may cause specific symptoms depending on which nerve is affected, called isolated mononeuropathy. Multiple nerve damage, called polyneuropathy, usually starts in the feet and hands and moves upward. It causes numbness, burning, or tingling and may affect both sides of the body. Small nerve fiber damage may cause sharp pain, poor temperature sensing, and weak reflexes, but may leave other senses intact. Large nerve fiber damage may cause balance issues, poor vibration sensing, and loss of reflexes, but touch may still be felt. Sometimes nerve damage happens unevenly or in unusual patterns and can slowly get worse over time, leading to trouble walking or using the hands. It might be due to unknown causes of autoimmune diseases like Sjögren's syndrome. If the spinal cord is cut or severely damaged, all feeling and movement below the injury level can be lost, including control over bladder and bowel. If only one side of the spinal cord is damaged, a condition called Brown-Sequard syndrome, the person may lose pain and temperature sense on one side of the body and strength or other sensations on the other side. Damage in center of the spinal cord, like in syringomyelia, can cause a unique type of sensory loss. People may not feel pain or temperature, but can still feel touch and vibration. When the damage is higher up, like in the neck, it can cause numbness or tingling in the arms and upper body. If it's lower down, the legs might be affected. Some spinal cord issues can cause a band-like feeling of tightness around the body or a feeling of pressure in the trunk or limbs. Flexion of the neck sometimes leads to an electric shock-like sensation that radiates down the back and into the legs in patients with cervical lesion in posterior columns of neurons, as in multiple sclerosis, cervical spondylosis, or following irradiation to the cervical region. Brainstem. If there's a problem here, it can cause strange patterns of sensation loss, like numbness on one side of the face and the opposite side of the body. This often happens in a part called the lateral medulla. Damage here affects certain nerve pathways that control sensation in the face, arms, and legs. Thalamus. This part of the brain processes sensation from all over the body. Damage here, often from a small stroke, can cause tingling or numbness on one side of the body from head to toe. In some cases, it can lead to thalamic pain syndrome, where the person feels constant, severe pain on one side, which can be very distressing. Cortex, parietal lobe. Damage to this area, which handles sensory information, may cause people to ignore one side of their body, called hemineglect, or not use an arm or hand properly. Even if they can feel things normally, they might have trouble with detailed touch tests. Rarely, they may also experience abnormal pain or numbness. Focal sensory seizures. These are seizures that start in a specific part of the brain responsible for touch and movement. People may feel tingling, warmth, or strange sensations like movement without actually moving. These usually start in one area, like the hand, face, or foot, and may spread in a wave-like pattern called a Jacksonian march. The seizure can last just a few seconds or much longer. Sometimes it can turn into a full-body seizure with loss of consciousness and jerking. Psychogenic symptoms. These are unusual sensory symptoms caused by psychological factors rather than a clear problem in the nervous system. For example, someone might feel pain or numbness around the waist or a joint, which doesn't match typical nerve patterns. These symptoms can be confusing. They might come and go, not match test results, or show unusual behaviors, like doing well on balance tests even though they say they can't feel their limbs. Just because a symptom is strange doesn't mean it's not real. It just might come from the mind, not the nerves. Test might include DT, nerve conduction studies, NCS, and EMG to test nerve and muscle function. Blood tests for B12, diabetes, thyroid issues, or autoimmune diseases. MRI or CT scans to check for structural issues, like herniated discs or brain lesions we have discussed. Sensory symptoms and signs resulting from the lesions at many different levels of the nervous system, from brain to the peripheral sensory receptor, are detected by correlating history and the investigation findings. Pro tip: don't dismiss recurring tingling as just stress without getting it checked. Your body might be whispering before it starts shouting. In some people, for example, numbness is the first symptom of multiple sclerosis, often years before a formal diagnosis. Therefore, do recognize your early symptoms. Spoiler alert, rubbing garlic and lemon on your wrist won't fix nerve compression, unless you're marinating yourself for a dinner party. Treatment options. Treatment depends on the cause. If it is for temporary compression, will resolve spontaneously within short time. However, if long-term issue, it should be diagnosed and treated properly. Many cases are reversible and easily manageable. For vitamin deficiencies, supplements and diet changes can work wonders. Eat vitamin B6 and B12 rich diet. For diabetes, controlling blood sugar slows nerve damage. Carpal tunnel syndrome, wrist splints, ergonomic tools, or in severe cases and surgery may be needed. Pinched nerves or spondylosis. Physiotherapy, posture correction, pain relief, and sometimes surgery is essential. Autoimmune conditions require neurologist care and specialized medications. Dysesthesias, when severe and persistent, may respond to anticonvulsants like carbamazepine, gabapentin, antidepressants like amitriptyline, nortriptyline, desipramine, venlafaxine, etc. Hey, don't try these medications without a doctor's prescription. These are just mentioned to make you aware that different treatment modalities are available. You don't need to feel helpless if one mode of treatment is not working. You will be prescribed an alternative when you follow up with your doctor. What's the weirdest home remedy you've heard for numb hands? Drop it in the comments. We might feature it in a future myth-busting episode. Prevention tips. While not all causes are preventable, here are some general tips to keep your nerves happy. Move regularly. Avoid sitting or standing in one position for too long. Watch posture. Your spine is not a noodle. Keep it aligned. Do not sit or do any work in same position long. Take breaks from screens and repetitive motions. Eat a balanced diet rich in B vitamins. Manage blood sugar and chronic conditions. Quick challenge. Can you go one full day without crossing your legs or slouching? Try it. Your nerves will thank you. So next time your foot falls asleep, don't panic. But if that tingling sticks around or comes with other symptoms, don't ignore it either. Your nerves are your body's communication network. Treat them well, and they'll keep you moving, feeling, and functioning like a champ. Like this video if your limbs have ever betrayed you mid-Netflix binge and share with anyone who has these nerve problems. Subscribe for more no-nonsense health breakdowns from DocDecoded, where we decode your symptoms one episode at a time.